The arm is just the leg backwards. As a joke that gets a laugh the first time you use it, just in case you wanted to, and by all means do. However, it is true to an extent, and we see this most commonly in the nerve distribution of the body between the arm and the leg, what you might call dermatomes. You can see that the arm and the leg have very similar pathways in this quadrupedal position, this bend forward position. And that's neat, but it also points us towards a relationship between the superficial veins of the arm and leg, as well as the superficial fascial tension that surrounds them. We have these larger superficial veins in our arm and leg. In the leg, we call them the saphenous, the greater, because it's longer, and the lesser, because it's shorter, well named. And in the arm, we have a long-short relationship in the basilic and cephalic. And these drain the superficial area, the skin and the fascia of their regions. Now, what commonly happens, and this is throughout the course of these veins, is these superficial veins, the light blue, will travel along this venous blood, and should it encounter some resistance, it can always go into the deeper system that's closely connected to it through a series of smaller veins. It tends to have a one-way valve system to allow this to happen in that one direction. But for the most part, a lot of blood is carried through this superficial system. Ultimately, they will empty into their respective larger, deeper veins. In the case of the knee, popliteal. In the case of the saphenous, greater saphenous, it's in the inguinal area. And in the case of the arm, we have the clavipectoral area, and as well we have our brachial. Now, that being the case, these are still comparably large veins, these superficial veins. They're of a good size, which must mean they do something important. If we all have them, we're designed to use them, means they're doing something reasonably effective and reasonably sustaining to the body. So it must be important that they function properly. With these veins, especially when they've been used in exercise, when we really have our cardiovascular system working, you can press easily on one of them, enough to occlude them, enough to stop them from working. They're visible, they're superficial, and again, that blood will be rerouted. I'm not saying you should do this. I don't recommend it in all fact, but you can block the flow of that vein, rerouting it to the deeper system, but ultimately stopping it from doing its job. And that is neat, but as well, we can make the relationship with the superficial fascia of the region. Each of these veins, these superficial veins, will have to pass through a fascia, connective tissue, to get to that deeper vein. No matter what it is or where it is, it has to pass through something. It's surrounded by that fascia in thicker proportions here. But as well, it's surrounded by a fascia throughout its entire course. So running through the leg or thigh, and then the leg proper. And then, of course, the arm as well will have fascias all surrounding these things. So they must pierce it, but they are covered by it. And so if it takes very little to slow down or prevent the blood flow through these superficial veins, probably means it could be done by something that also changes that fascial tension. Fascial tension specifically. Now, it would be very easy. One easy example would be just to wind up the leg, spin it in a direction, or spin that arm in a direction and change the tension, essentially changing the pull from one point to another, making it so the tissue is further apart. And that puts pressure, it changes tension by putting pull on the tissue and puts pressure back on that venous system, enough to make it a little harder for it to function. And this can be the case, but most often not. It's surprising. Most of the time we're able to hold our arms and legs in a relatively neutral or normal position because we can see them, we see where they hang, and so we don't do that. It's a conscious thing. However, by comparison, the body can be very twisted up. We could have, let's say a forward hip on this side and a nice spin through the low lumbar spine, and then the opposite spin through the thorax, and then a good twist and a roll through the upper girdle, and the neck, is doing something crazy like this. Head's all on crooked. Wouldn't really do that, but something like that. And because of that, because the body can be all twisted up, what it does is it makes points further away. Say this point, entrance of the greater saphenous into the inguinal area. Because the body is all twisted up, it can pull from as far as one side to the other, opposite side. It can pull from the body into the leg and change the tension in that superficial area. And this is, of course, not dangerous. It's not a huge problem. But given enough time, it means your cardiovascular system, your venous system is functioning suboptimally. So if you can find someone who can work with that fascia to do some of these twists and pulls and irritations into that system, you may find that your whole body is working just a bit better.